Good evening. Two mothers from Birmingham have spoken about the severe postnatal depression they experienced and the struggle to find support. Both say they sought help, but services for new mothers are under pressure with long waiting lists and limited funding.
An ITV News investigation has found some women are waiting more than a year for support with the most serious and complex mental health problems. A warning, Ravneet Nandra's report contains references to self-harm and suicide.
Do you love me?
Thank you, Mummy.
Emma loves life with her 3 children, but it wasn't always this happy. She had a difficult birth with her second child, and while pregnant with her third, she had flashbacks of her previous labour. She experienced severe postnatal depression, so severe she wanted to end her life.
I felt as though I'd been sucked into this black hole, and I was having no joy in life and I was wanting to do nothing. And then I started self-harming. I needed that release, and I needed to feel something, and I needed to take control of my life because I didn't have control and I didn't choose this depression.
Sadly, stories like Emma's are not uncommon. Chloe experienced postnatal depression after both her children's births and didn't know where or who to turn to.
But there were many times where it would be going to the bathroom for just 5 minutes to try and get myself together again, or have that little cry. I was just putting that mask on and trying to get through every day.
Why do you think you had to put that mask on?
I think part of it is trying to convince myself that I was okay.
Emma and Chloe both found help through a Birmingham-based charity, Acacia. They had regular phone calls and group meetings, but not all women are as lucky. And for some, the only help they can get is through the NHS. 1 in 4 new and expectant mums will experience mental health issues, with suicide the leading cause of death for women in the first year after giving birth. But an ITV News investigation has found that waiting times for the most unwell patients are rising as more people need treatment. Figures obtained by Freedom of Information request show nearly 53,000 patients were referred for specialist help in 2024. Around 500 patients waited over a year for their first appointment, nearly double the year before. The Royal College of Midwives is one of many organisations putting pressure on the government.
There's been significant underinvestment in services for a long time. So services are quite depleted. We are calling for strengthened leadership and make sure that the right funding is available to support the provision of good perinatal mental health support services.
3, 2, 1, whee!
Emma and Chloe say they're now enjoying life to the fullest, something they thought wasn't in their reach.
I wasn't a happy mum to be around, and I know I wouldn't have been a good mum to my children had I have not had that support from Acacia. So yeah, I think it opened that door for me to find myself again.
Without them, there's a very good chance I wouldn't be here today and that my kids would not have their mum. I owe them everything, I really do.
Well, Ravneet is with us now. My goodness, tough hearing what they've been through, Rav. But I understand that the charity that supported them is itself asking for help.
Yes, I would first like to thank you to Emma and Chloe for just speaking to me so candidly about their experiences. And you're right, they sought help, but the place that they sought help now needs help themselves. It's Acacia, the charity, and they're based in Sutton Coldfield, and they said that they're seeing a lack of donations and money from public funding and grants, and they said that their service is vital to deliver life-saving services in person and online, and for dads as well, but without that funding they think they'd have to reduce their services.
It's so important for families across Birmingham because here in the city, postnatal depression rates are higher than average from across the rest of the country. So it's absolutely vital that we keep running our services. Ultimately, if we're looking to lose 20% of our income over the next 12 months, and that inevitably will have an impact on the number of staff that we're able to employ.
Now, Acacia told me that they pride themselves in having short waiting times, but as you heard in my report, that's not the case for everyone. Now, NHS England has told us that they have expanded their services, but it's unacceptable that some women are experiencing such long waits. And they added that every GP is actually expected to do a 6-week checkup with new mums. The Department of Health said that the government inherited a broken system, and they are committed to improving the care mothers receive. Now, it's clear patients and healthcare professionals are frustrated at the current system and they want to see some meaningful change.
Ravni, thank you very much indeed.